My name is Taylor. We're going to do a cardiac assessment. Hello, my name is Taylor and I'll be doing a cardiac assessment on you. For this first part, I'm going to be looking at your neck. I'm going to look at what's called your JVP. So I'm going to have you do, I'm going to shine a light, and then I'm just going to have you look that way for a second. Okay, I don't see any pulsating. So now we're going to look on the other side, do the same thing, just on the other side. I don't see any pulsating on that side either. So now what I'm going to look at, I'm going to lean you down just a little bit more. I'm going to look at your PMI here on your chest. Don't see any pulsating there either. So now what I'm going to do, I'm going to be touching your chest here. So I'm going to be palpating your carotids first, and then I'm going to move across your chest. So what I'm going to do right now, palpate your carotid. Okay, about a 2+ pulse on that side. 2+ on that side. So first what I'm going to do, I'm going to find your angle of Lewy, which is here up at the top of your sternum where it meets the mabrinium. So we got it right here. Then I'm going to move down your second intercostal space for your aortic area where I feel a light pulsation. Go back to the top, move down to your second intercostal space on the right side, which is your pulmonic area. And then I'm gonna move down to your fourth intercostal space, which is your tricuspid area, and I feel a light pulsation there. I also felt a light pulsation up there. So in your fourth intercostal space, I'm going to go between your fourth and your fifth midclavicular line, which is your mitral area. This is also your area of PMI. I was able to feel a light pulsation, and then okay, and then with that PMI, I was also able to feel just a tapping impulse. Okay, and then now I'm going to move on to auscultation. So I'm going to take a listen. So I'm going to listen to your carotid arteries. So when I do that, I'm going to have you just hold your breath for a second, okay? Hold your breath. Good, normal sound. Hold your breath. Okay, I'm gonna listen with the other side of the stethoscope. Hold your breath. Now we're gonna do the other side. Okay, now I'm gonna auscultate different parts of your heart. You just breathe normally for me. Listen with my other side of my stethoscope. Okay, with all of those, I was able to hear all of them, which sounded, they all sounded were normal sinus rhythm. There was no they were all regular, no irregular rhythms noted. I did not hear any murmurs. I did not hear any extra sounds such as like an S2 or an S4, or like gallops or clicks. So I'm going to have you do for the next one, you're going to stay in this position best you can, but I'm going to have you kind of roll onto your left side, and I'm going to take a listen to listen to your heart. So best you can. I know you're in a chair. Lay down. I'm going to have you kind of bring this arm up. Yep, bring that arm up. Okay. sounded normal. I was not able to hear any murmurs or S3 or S4 sounds. So for this next one, I'm gonna have you put your feet down for a second. So what I'm gonna have you do, kind of sit at the edge of the chair for me and kind of like hunch over a little bit, just like that. So I'm gonna take a listen. And when I place my stethoscope, can you just exhale for me? Let me do it the other side of my stethoscope. Good. Okay. I did not hear any murmurs with that. So what I can do, you can lay back just how you were. You can put your feet up if you'd like. Okay, so for this, I'm going to inspect your arms first. So I'm going to look at the size. They look normal size. And then I'm going to also look at, they look symmetric on both sides. And then I don't notice any signs of edema or swelling. And then for the next one, I'm going to just take a look at your skin. Looks pink in color. I don't notice any, I'm gonna look at your fingers too. I don't notice any like paleness or blueness or anything to your fingers. And then I'm also gonna look at your veins, so you can kind of roll out for me. Looks like you have good venous patterns on both arms. Okay, now I'm going to inspect your legs. So I'm going to do the same like I did before. Look at both legs. They look the same size on both sides. They're normal in size, shall I say. I don't see any swelling, and then they are symmetrical on both sides. So I'm going to do them, look at the color also. They look pink. I don't notice any discoloration, rashes, scales, sores, or ulcers, anything like that. I also didn't notice any like blue blotchiness, redness, or anything like that on your legs. I'm also going to look at, sorry, I'm going to lift your shorts up a little bit. Okay, you have even distribution of hair down your legs, feet, and toes. And then, sorry, one more thing, I do have to have you stand up for this one. I'm just going to look at your veins in your legs when you stand up. Okay, those look good. I do not see any varicoses on those, so you can sit back down. So now I'm going to, you can put your feet back up because I'm going to do your legs after I do your arms. So what I'm going to do, I'm going to palpate some pulses. So I'm going to feel your pulse on this side. Good, strong 2+ pulse. I'm going to feel your pulse up here. Good, strong 2+ pulse. Come on this side. Your brachial, good, strong 2+ pulse. And also your radial, good, strong 2+ pulse. Okay, I'm going to check your fingers. I'm just going to squeeze the end of your fingers. Let me do this hand. Okay, looks good. Capillary refill was less than 3 seconds, so I'm also going to palpate in your arms. Look for any epitrochlear nodules, which I do not see or feel. Let me look at the other one. Sometimes you can just have like bumps. That's what I'm looking for. Okay, do not see anything on those. So now I'm going to move on to your legs for this part. You are going to feel me, I'm going to palpate pulses, okay? So you're going to feel me palpating your groin. Good 2+ pulses in your femoral. I'm going to feel behind your legs for your popliteal. Good, 2+ pulses. Now I'm going to feel the pulses in your feet. Good pulse, 2+ dorsalis pedis and posterior tibial. Okay, those are also 2+ dorsalis pedal and posterior tibial. And then I'm going to also look for nodules, inguinal nodules, which could be in your groin area. I'm just going to feel. I do not feel any nodules there. The next thing I'm going to do, I'm going to feel for warmth. So I'm just going to kind of move my hand up and down your legs, okay? They were warm on both sides. I did not feel any coolness down towards the end of your legs, and they were equal on both sides. And then, so the next thing I'm going to do, you're going to feel me kind of squeeze your foot a little bit. Okay, I do not see any pitting edema in your feet or, sorry guys, squeeze your ankles. On your ankles, and then I'm going to do your shins. Good, I do not see anything on that. Okay, for this next one, I'm going to do it on both of your hands. So on this side, can you make a fist real tight? I'm going to hold your arteries, and then I'm going to tell you to let go of your hand. Let go of your hand. Okay, so you had fast refill. It went from that pale back to pink, less than 3 seconds. So you did good. So now we're going to do the other side. So make your hand into a fist again on this side. Okay, now release. Okay, sorry, I need to do it one more time. Okay, good refill. Your color came back less than 3 seconds. So now I'm going to do the same thing on the other side. Big fist. Okay, let go. Good. Okay, color came back. We're back to pink with it less than 3 seconds. Okay, other side. Okay, you can let go. Good. Okay, color came back from pale to pink with less than 3 seconds. So now what I'm going to do, I'm going to do it with your feet. So kind of how we do this, I'm going to hold your legs up until you kind of lose the color in your feet, and then we're going to sit and you're going to put your feet down. We're going to see how fast. This might take a little bit longer than those. Okay, so kind of put your legs together. I'm going to hold them up. Okay, are you able to get that? Now, help you lower your legs. See the color come back. Okay, there we go. Looks good. That was less than 10 seconds. The color came back to your feet, so that is what we would want.